Hi, my name is Jim and I was retired. Have you ever wanted to go back in time to see if you made the right decision? Well, in this week's video, I'm going to go back and look at the decision I made 2 years ago to select Plan N for my Medigap plan. I did a spreadsheet at that time to compare the options, and in this video, let's look at that choice between Medigap Plan G versus Plan N 2 years later. Stay tuned. Now, this week's video is really a counterfactual. You really don't need to shop for your Medicare supplement plans or Medigap during this annual enrollment period. But December is also my anniversary month, so I have a rate increase for my Plan N from Mutual of Omaha. It's going up 4% from $124 to $129 a month next year. So what would I be paying if I had elected to stay with the more inclusive and more expensive Plan G when I turned 65? When you sign up for Medicare, you are faced with your first choice. Do you stick with original Medicare with a Part A for hospital care, a Part B for doctors and labs? Then you add a Part D prescription drug plan and your supplemental coverage or Medigap policy to cover the 20% that Medicare doesn't cover. Or on the right, do you go with Medicare Advantage, a Part C that turns your Part A and Part B over to a private insurer, which may also add a Part D drug coverage and other extra benefits? But if you go with the Medicare Advantage route, you will not shop for a Medigap policy. Your Part C includes everything in one managed care model. Now, if you do go with original Medicare, though, you will want to add that Medigap policy unless you have retiree health care or a union plan that will pay the 20% balance. Now, Medicare Options are all standardized by law and each known by a letter. All insurers that offer a Plan A, for instance, must offer the same benefits, but insurers set their own premiums, which vary by market. Now, two of those plans, Plan C and Plan F, are no longer available to those who joined Medicare after January 1st of 2020. So I've shaded out those from this graphic from Medicare.gov. And that leaves you with the rest of those choices. Of those, Plan G and Plan N are the most popular. Medigap Plan G, which offers the broadest set of benefits, covers everything but the Part B deductible. In fact, part of the decision to take Plans C and F off the list is that Congress didn't want Medigap plans to cover the Part B deductible, which should be your copay for the medical care that you're getting. So Plan G is now the most popular and most expensive in most markets. Here in New Jersey, premiums start at $153 a month for somebody my age. Plan N covers everything that Plan G covers except Part B excess charges. And it uses modest copays of $20 for an office visit or $50 for ER. In exchange for those copays, monthly premiums start at about $112 or about 25% less than Plan G. Now, some are scared off by this not paying for excess charges, the fees in excess of Medicare assignment. But Medicare.gov offers a very easy way to ensure that your doctors accept Medicare assignment and agree not to bill you those excess charges. Also, Kaiser Family Foundation reports that only about 1% of doctors have opted out of Medicare and don't accept Medicare assignment. When I did my original research in Medigap plans, I also looked at the Plan G high deductible, which offers much lower monthly premiums in exchange for a high deductible. Now, that's linked to inflation and it goes up each year. And you have to pay all of that before the insurance kicks in. Now, if you'd like to see why I did not elect this route, please go to my earlier video here. Now, I found this study in the Congressional Research Services report on Medigap that reports the enrollment trends in recent years. And the most popular plans are Plans F for those who still have it. Again, if you were on it before 2020, you're allowed to keep it. Plan G for those joining Medicare after 2020, and Plan N. Now, I plugged these numbers into a chart to show you the slow decline of Plan F in red from about half in 2018 to 41% in 2021. You can also see the growth in Plan G in light blue from about 17% to 32%, and a steady 10% of enrollees who use Plan N with its modest copays in the dark blue. Here's a spreadsheet that I used 2 years ago when I did my original Medigap shopping and looked at the choices between G high deductible, and N. And I've narrowed the choice down to just comparing G and N to see what would have happened. If you could see, the monthly premium average that I was being quoted for G was $158.83. And the average premium that I was being quoted for N was $116.08. And that's a $42.75 difference between the two. Recognizing that under Plan N, you'd have these copays, modest cost sharing of $20 for an office visit and $50 for an emergency room visit. Well, if you look at the annual premiums just of the Medigap policy, you could see G would be running you $1906, let's call it, and N would be running you $1,393. And that's like a difference of $513 a year in the two Medigap policies. And if you just looked at that and then divided 20 into that, you would have to have 25.65 office visits a year to come up to where you'd be spending as much as Plan G. So that's one part of the equation. Now, in a lot of my spreadsheets, I use one tab for input to put in some key variables in what I'm trying to study. And here is a version of what I did 2 years ago, again, narrowed down to just the choice between G and N. And these are those monthly premiums. And then I assumed originally that I'd be seeing the doctor about twice a year, maybe 2 specialists a year. And I'll allow one ER. I would tell you in the last 2 years, I haven't been to an ER. So that was like padding the estimate a little bit. I'll also say that these 2 visits, total of 4 visits, that would be times 20 under Plan N, is also overstating it, and I'll get to that in a minute. I had some CPIU and average CPIU for long-term projections of costs. That's next year's Part B deductible, which you're going to pay under either plan, and that's next year's premium. And again, you're going to pay that premium in addition to the Medigap policy each month. When I did this 2 years ago, I used the same guess for a increase in premiums, 4.5% a year for both plans. And I've been doing some work to understand if that's the case or whether I should change it. And one of the things I came up with was this CGS actuarial, which has tracked rate increases for a number of carriers and then averaged them out. And this is part of a workbench that brokers actually use when they tell you what the average rate increases are in a particular zip code. But for a national average, this is the report. And it showed that G here had increases with a 5-year average of 4.96. And Plan N had increases with a 5-year average of 3.64%. And the trend, if you see, is that N has been declining and G has been increasing in their national average picture. And so rather than using the same price increase for Medigap, my study is going to use two separate. And those are the inputs here. I'm going to use an average increase of 4.96% for G and 3.64% for N. And then I'm going to run the comparing spreadsheet again with those two models. This was going back to age 65, and we'll say these are the actual Part B premiums for the last few years, the one for next year, and then these are the trustee report estimates for the next few years until it gets down to here, and then it's going to use an estimate above that where it's going to use the projected increase of using an average. And then I'm using, for G, I'm using specific percentage increases for G and a specific increase for N. Now, those are the monthlies. These are the annual figures for the Part B premium that you're going to pay under either Medigap plan, the annual for G, the annual for N. You'll also have to pay the deductible. And so the next columns over here include the total healthcare costs for Plan G with the Part B added, and then the total healthcare costs for Part N with copays added. And going back to that formula, I'm going to edit the formula here to show you it. So this formula adds up the deductible, the annual Plan N premium, and the annual Part B premium, and then it adds $20 times the sum of these inputs. And again, those are the office visits back on the input screen, as well as $50 times the input of ER visits. And again, I think I'm padding it a little bit, and I'll explain in a moment. I haven't had an ER visit in the last 2 years, so right there it's $50 off for the last 2 years. And so this adds the figure for Plan N. And then it has two running totals here. And it comes down to these charts here. This is the annual numbers. Experience has been here, and then I'm going to let inflation pick up. You'll see the green line never catches up to the blue line and is always going to be less expensive than G in the projected future. And on the cumulative totals, you can see you're going to save significantly under Plan N. Now, this is the cumulative premiums only through age 80 for Plan G and Plan N. Now, in both cases, I'm looking at the cumulative premiums only through age 80 for both the Medigap policy, either Plan G or Plan N, and the Part B premiums that you'll be paying. And here is the adding in the out-of-pockets, particularly for Plan N. Even adding those modest copays that I put in there, you're saving about $12,000 by age 80 by going with Plan N. Unless you are visiting doctors more than twice a month, the premiums plus the copays under Plan N will not surpass the higher premiums of Plan G. But if you are seeing doctors that often, maybe Plan G is right for you. But if you're only seeing doctors several times a year, the savings will be well worth the modest copays. Now, I mentioned when I did this study 2 years ago that the other key ingredient for Plan N versus the Plan G high deductible was that the high deductible figure will be inflated every year with CPIU, the Consumer Price Index for urban workers. But the modest copays of $20 for an office visit and $50 for an ER are hard-coded into legislation. They do not adjust each year, and therefore you're going to have some inflation protection in those modest copays going forward. There is one theory that Plan G, because it is a guaranteed issue plan, and that means anybody who falls into the guaranteed issue categories, and that's the first 6 months of enrollment in Medicare, plus if you lose coverage in certain circumstances, an insurer offering a Plan G must accept you with no medical underwriting. Plan N is not a guaranteed issue plan. So except for those 6 months around Medicare enrollment, every time you select Plan N, you would need medical underwriting to get into the plan. And those risk pools may mean that Plan G will see higher increases in the future. I really don't know whether Plan N will see more modest price increases compared to Plan G. Time will tell. But for now, I'm still very pleased with my experience with Plan N. I will also tell you that in doing this research for this video, I asked people who were out there on Plan G what kind of experience that they've had in the last few years. The more important ingredient was the insurer they selected. And that's why a broker, a national broker that represents multiple companies with good data sets, can give you the guidance to select a company that is known for only one rate increase a year, modest increases, and has been in the business for a long time, not somebody who's getting in with a low price and may not be here tomorrow. So using a broker to select your Medigap policy is probably the best thing you could do. Select the right insurer. But if you've got a choice between a Plan G and a Plan N with a quality insurer, go with the Plan N. Hey, please like and subscribe to this channel if you like entertaining ideas from a DIY retiree. I'm not selling a course. I'm not a Medicare broker. I'm just a consumer sharing my perspective to help you plan for your own DIY retirement. I will conclude with my standard warning. I have no initials after my name. So take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one. See ya.